Dear friends, welcome to our channel. Today we are going to talk about diabetes, heart disease, and stroke. What is the link between diabetes, heart disease, and stroke? High blood glucose from diabetes can damage your blood vessels and the nerves that control your heart and blood vessels. Over time, this damage can lead to heart disease. People with diabetes tend to develop heart disease at a younger age than people without diabetes. Adults with diabetes are nearly twice as likely to have heart disease or stroke as adults without diabetes. The good news is that the steps you take to manage your diabetes also help lower your chances of having heart disease or stroke. Your risk for heart disease is greater if you are male rather than female, whether you have diabetes or not. If you do have diabetes, other factors add to your chances of developing heart disease or having a stroke. Smoking raises your risk of developing heart disease. If you have diabetes, it is important to stop smoking, because both smoking and diabetes narrow blood vessels. Smoking also increases your chances of developing other long-term problems such as lung disease, lower leg infections and ulcers, and foot or leg amputation. If you have high blood pressure, your heart works harder to pump blood. High blood pressure can strain your heart, damage blood vessels, and increase your risk of heart attack, stroke, and eye or kidney problems. Have your blood pressure checked regularly and work with your doctor to control or lower high blood pressure. Cholesterol is a type of fat, produced by your liver and found in your blood. You have two kinds of cholesterol in your blood, LDL and HDL. LDL, often called bad cholesterol, can build up and clog your blood vessels. High levels of LDL cholesterol raise your risk of developing heart disease. HDL is sometimes called good cholesterol. Higher levels of HDL is linked to lower risk for heart disease and stroke. To improve LDL and HDL levels, limit the amount of fat in your eating plan, eat more plant-based foods, and get regular physical activity. Another type of blood fat, triglycerides, also can raise your risk of heart disease when the levels are higher than recommended by your healthcare team. Being overweight or having obesity can make it harder to manage your diabetes and raise your risk for many health problems, including heart disease and high blood pressure. If you are overweight, a healthy eating plan with fewer calories and more physical activity often will lower your blood glucose levels and reduce your need for medicines. Excess belly fat around your waist, even if you are not overweight, can raise your chances of developing heart disease. Heart disease is closely linked with chronic kidney disease, a condition in which your kidneys are damaged and can't filter blood the way they should. Having diabetes is a risk factor for developing kidney disease, which affects about 40% of people with diabetes. Other risk factors for developing kidney disease are high blood pressure and a family history of kidney failure. A family history of heart disease may add to your chances of developing the condition. If one or more of your family members had a heart attack before age 50, you have double the chance of developing heart disease compared with people who have no family history of the disease. You can't change whether heart disease runs in your family. But if you have diabetes, it's even more important to take steps to protect yourself from heart disease and decrease your chances of having a stroke. Taking care of your diabetes is important to help you protect your heart. You can substantially lower your chances of having a heart attack or stroke by taking the following steps to keep your heart and blood vessels healthy. Know your diabetes ABCs to help you manage your blood glucose, blood pressure, and cholesterol. Stop smoking if you have diabetes to lower your chances of developing heart disease. The A1C test shows your average blood glucose level over the past 3 months. This is different from the blood glucose checks you do every day. The higher your A1C number, the higher your blood glucose levels have been during the past 3 months. High levels of blood glucose can harm your heart, blood vessels, kidneys, feet, and eyes. The A1C goal for many people with diabetes is below 7%. Some people may do better with a slightly higher A1C goal. Your A1C goals may also change as you get older and your lifestyle changes. Ask your healthcare team what your goal should be. Blood pressure is the force of your blood against the wall of your blood vessels. If your blood pressure gets too high, it makes your heart work too hard. High blood pressure can cause a heart attack or stroke and damage your kidneys and eyes. The blood pressure goal for most people with diabetes is below 140/90 mmHg. Ask what your goal should be. A buildup of cholesterol, a form of fat found in your blood, can cause a heart attack or stroke. Ask your healthcare team what your cholesterol numbers should be. If you are over 40 years old, you may need to take medicine, such as a statin, to lower your cholesterol levels and protect your heart. Some people with very high LDL, bad cholesterol may need to take medicine starting at a younger age. Quitting smoking is especially important for people with diabetes because both smoking and diabetes narrow blood vessels, so your heart has to work harder. E-cigarettes aren't a safe option either. If you quit smoking, you will lower your risk for heart attack, stroke, nerve, kidney, and eye disease, and amputation. Your blood glucose, blood pressure, and cholesterol levels may improve. Your blood circulation will improve. You may have an easier time being physically active. If you smoke or use other tobacco products, stop. Ask for help so you don't have to do it alone. Ask your healthcare team about your goals for A1C, blood pressure, and cholesterol, and what you can do to reach these goals. To improve your diabetes self-management skills, you may want a referral to a diabetes educator or a registered dietitian. Medicare, some private insurers, and other organizations will provide financial assistance for some of these services. Develop or maintain healthy lifestyle habits. Physical activity can help you manage your diabetes and may help you cope with stress. Healthy lifestyle habits that you stick with can help you manage your diabetes and prevent heart disease. Follow your healthy eating plan. Make physical activity part of your routine. Stay at or get to a healthy weight. Get enough sleep. Managing diabetes is not always easy. Feeling stressed, sad, lonely, or angry is common when you are living with diabetes. You may know what to do to stay healthy but may have trouble sticking with your plan over time. Long-term stress can raise your blood glucose and blood pressure, but you can learn ways to lower your stress. Try deep breathing, gardening, taking a walk, doing yoga, talking with a loved one, working on a hobby, or listening to your favorite music. Medicines may be an important part of your treatment plan. Your doctor will prescribe medicine based on your specific needs. Medicine may help you meet your A1C, blood glucose, blood pressure, and cholesterol goals. Reduce your risk of blood clots, heart attack, or stroke. Treat angina, or chest pain that is often a symptom of heart disease. Angina can also be an early symptom of a heart attack. Treat heart failure, which is a form of heart disease in which your heart cannot pump blood well enough for your body to work properly. Take medicines as prescribed. Ask your doctor whether you should take daily aspirin. Aspirin is not safe for everyone. Your doctor can tell you whether taking aspirin is right for you and exactly how much to take. Statins can reduce the risk of having a heart attack or stroke in some people with diabetes. In addition, certain diabetes medicines have been shown to reduce the risk of heart attacks and death in patients at very high risk of having a heart attack. Talk with your doctor to find out whether taking a statin or a diabetes medicine that reduces heart attack risk is right for you. If you've tried all sorts of diets and they haven't worked, we recommend reading the book Smart Blood Sugar about the way to safely and naturally control your blood sugar levels. The link will be in the description and in the comments.